Hi. Uh, well, unfortunately, you can't prevent pancreatic cancer, but you definitely can cut down the risks, like no smoking, no drinking. You'll be like, what's the point of living? But nevertheless, if you are able to maintain obesity, have a good balanced life, well, you can definitely cut down your chances of pancreatic cancer. Symptoms. Many times, symptoms come only when it becomes stage 3 or stage 4, because patients would come with either abdominal pain, stomach pain, or the back pain. They can come. But if you'll be lucky if you're able to identify it in the initial stages, then the first and second stage, if it is occurring next to the head of the pancreas, that is a part of the pancreas. Many times patients can present with jaundice, that is very deep jaundice, and if it is not associated with any back pain or abdominal pain, we are very happy. That means to say that the patient is, the tumor is operable. So deep jaundice, back pain, or stomach pain, these could be the symptoms. To detect pancreatic cancer, one, clinical suspicion, clinical examination, and after that, you would either do an ultrasound or a CT scan or an MRI of the abdomen, and then you'll be able to find a mass. So the pancreas has, you have a head of pancreas, you have a neck of pancreas, you have an uncinate process, body of pancreas, and tail of, it's like a different animal by itself. But nevertheless, you have all of these parts. The guys who was actually imagining and the anatomist who was drawing, it's a very imaginative fellow. So therefore, you have so many different parts of the pancreas, and each different part of the pancreas, if you have the tumor growing, then you attribute that portion to it. Pancreatic cancer, later stages, is mainly due to the position of the tumor. If it's in the head and uncinate process of the pancreas, then afterwards you'll be able to detect it very early, because the patient would present to us with jaundice. But if it comes in the body of the pancreas or the tail of the pancreas, this tail is always one tail ender, like kind of stuff. If it comes into these particular areas, then the patient would, there will be no symptoms initially, that will keep growing and growing and growing. Then it will touch the surrounding structures, then it can go into the liver, it can go into the back. Then the patient comes to us with tummy pain, or he comes to us with very bad, severe back pain. So that's why, and that point, when he comes with severe pain, the tumor is inoperable. Breast and pancreas, is there a correlation? One would think it is unlikely, but then after that, actually there is this BRCA mutation. Remember the Angelina Jolie mutation, the BRCA for breast and ovarian cancer? In males, it can present to us with pancreatic cancer or sometimes even prostate cancer. So yes, there is a correlation between breast and pancreas. Generally, most of the times it is not, but if you take into account that the BRCA mutation, yes, it can be considered to be a genetic disease. And in some cases that you find no mutations at all, but yet familially you will be having these kind of the father, the son, and the grandson. They all could be having it at a certain time point in their lives. So those kind of, if you have a family member or 2-3 family members who have been afflicted with either pancreatic cancer or breast or ovarian cancers or prostate cancer, then it's important. ನೀವು ನಿಮ್ಮನ್ನ ಚೆಕ್ ಮಾಡ್ಕೋಬೇಕು. You have to get yourself checked. There are certain genetic tests. When you come to an oncologist, we guide you as to how to go about that. Well, there's a theory that says that almost most pancreatic cancers, they start off with a pancreatitis. Doesn't mean that every time who has a pancreatitis is going to develop pancreatic cancer, but 1 or 2% of them might get. But the theory is that before pancreatic cancer starts, there would be some amount of pancreatitis which would occur in the pancreas. So, take home message, not all pancreatitis becomes into a pancreatic cancer. Many of them feel that once you have a pancreatic cancer, it's the end of the day. No. If we are lucky, if we are able to identify it in the first and second stages, we can operate and remove it. Even if it comes in the stage 4, around a few years back, around 5-6 years back, the lifespan was only 3 to 6 months, and it used to be very painful. But now, with the advent of more molecular oncology, we've been able to diagnose and identify different mutations. Like if you have the BRCA mutation, these people, they respond very beautifully to a tablet called olaparib, or it's also called PARP inhibitors. These patients respond very beautifully, and they live longer and live healthier. Thank you. If there are any more questions you'd like to know about pancreatic cancer, you could probably post a comment and we will answer to that. Have a good day.